A major complication occurred the following year during bronchial artery embolization for massive hemoptysis in a young patient. Although the bleeding was controlled, a 4 French royal flush catheter with a guide wire got stuck in the right bronchial artery and could not be retrieved. Attempts caused severe pain, and amid pressure from large crowd, the catheter was left in situ and the patient was shifted to KEM. Dr. Ravi sir also attempted retrieval and concurred that it should be left alone, after which the relatives were calm and counseled. News atom for FTR came in March 97. The first cath lab with DSA and roadmap was installed at Super Specialty Hospital. I was appointed honorary professor there. The first carotid stenting in the region was performed on 4th October 1998, marking a high-stake neurovascular milestone and firmly establishing IR in the treatment of stroke and complex neurovascular disease. It signals Central India's readiness for state-of-art endovascular care. The patient belonged to CIMS under Dr. G.M. Towry, who graciously acknowledged the procedure in the annual report of CIMS despite it being performed at another hospital. Spandan Heart Institute installed a Philips cath lab in February 99. So all the cardiology work generating from there about peripheral work that I used to do there. CIMS cath lab got digitalized and upgraded to DSA and roadmap, and ECOM aneurysm coiling was done in 2001. Third National Registry meet was conducted in CIMS. This was a significant milestone as all stalwarts of IR were there in Nagpur. We took this occasion to make public awareness and publish advertisement in local newspaper about embolization and revascularization procedure. 2003 saw 2 more cath labs coming to Nagpur. And this was a significant case. A young woman presented with flash pulmonary edema and hypertensive crisis and found to have solitary ectopic right kidney with high-grade renal artery stenosis and aneurysmal dilatation and with a fistula into renal vein. She was successfully treated with balloon expandable stent graft, marking a remarkable regional milestone. Wokad Hospital, a corporate setup, came into Nagpur, and that changed the awareness part of IR in medical community as well as in general population. Radirecognizer chart was created, which included problem, presentation, etiology, and procedure. And I think I am thankful to Vimal when he was in Bombay Hospital. That time he had created some booklet. On that line, I have created this radirecognizer chart. Even brochures for general public awareness, they were published and distributed. I was keeping my vascular system up to date by going for walks, trekking in Himalayas, and visiting places with family. Beginning 2002 with intracranial, arterial, and intravenous thrombolysis, first using urokinase lateral actylase, and progressing to mechanical thrombectomy, Nagpur emerged as an aggressive IR center. Contribution of Sachin Domne along with Dr. Atul Revatkar and Rajesh Mundra. A major academic milestone was establishment of DM program at Datta Mege Institute of Medical Sciences. I served as a TFAC domain expert from 2007 to 2012, and under Dr. Pankaj Banode, the department expanded with fellowship and DM program. This academic momentum soon spread, with GMC also starting DM program under Dr. Jawahar Rathod's leadership. Meanwhile, I conducted a unique CME on the occasion of Silver Jubilee of CIMS, wherein a clinical problem was presented by a diagnostic radiologist, discussed by a panel of clinicians, and moderated by interventional radiologists. It was a huge success. All goats of IR were there in Nagpur. First transradial carotid stenting was done in February 2010. In the same year, first hybrid cath lab with installation in 2010, and Nagpur has arrived at global level. All complex aortic and visceral procedures were performed in this lab. Hybrid procedures were done routinely here, and you know this duo, the first IR entrepreneur duo of India with successful own setup. Now they will be shifting to a new setup, bigger new setup. In 2014, India honored Sachin Tendulkar with Bharat Ratna, recognizing a lifetime of excellence. In a fitting professional parallel at the 16th annual conference in Mumbai, the same year, I was awarded the prestigious Legion of Interventional Radiology honor. article to this effect came in Times of India. 5 stalwarts from Nagpur School of IR now serve as global brand ambassadors to the region, each leading a distinct subspecialty. Together, they exemplify the clinical excellence, academic rigor, and global reach of Nagpur IR. 2 major events were conducted in Nagpur: 18th ISVIR Registry cum Complication Meet in 2016, and update on venous diseases in November 2018. Beautiful setup of cath lab was installed at Viveka Hospital. Did 2 contour device placement, one in unruptured ICA top and another ruptured MC aneurysm on single day. Public awareness through newspaper articles continued. I was humbled to receive Lifetime Achievement Award by Vidarbha chapter of Maharashtra State Radiology Association. Tradition of excellence continues in my family. My elder daughter Neha and her husband Aniket, school-time companions, now serve Canadian healthcare. Neha is a dental surgeon and Aniket is a hematologist at Princess Margaret Cancer Center, Toronto. Similarly, my younger daughter Isha, an interventional radiologist, and her childhood friend and husband Pratik, a hemato-oncologist, both GMC Nagpur graduates, are pursuing their career together at Brown University, Rhode Island. Father-daughter duo attended SIR 2022 at Boston.